Hello, I am Ronald de Wit. I'm a medical oncologist at the Erasmus University Medical Center in Rotterdam, the Netherlands, and I was one of the steering committee members and one of the co-investigators of KEYNOTE 45 study. KEYNOTE 45 was a randomized phase 3 clinical trial comparing the checkpoint inhibitor pembrolizumab versus investigated choice of chemotherapy as a second-line treatment option in patients with advanced or metastatic bladder cancer. Now, the investigated choice of treatment would be either docetaxel, paclitaxel, or vinflunine. Again, in patients who had previously been exposed to platinum-based chemotherapy. Now, we know that chemotherapy in second line in bladder cancer is modestly effective, with a meager median survival of around 6 to 8 months. And in point of fact, in this clinical trial, the efficacy of the chemotherapy was even more disappointing. The primary endpoint of the study was co-primary overall survival and progression-free survival, both for the intent to treat patient population as well for the patient population with PD-L1 expression. And PD-L1 expression was measured both on the cancer cells as on the immune cells. The key outcome of the study was that there was a robust and clinical, meaningful, and statistical significant survival improvement. And the median overall survival in patients who were treated with pembrolizumab and 200 milligram every 3 weeks by IV infusion was 10.8 months, and this was only 7.8 months in the patients receiving chemotherapy. So a 3-month survival improvement, the hazard ratio of 0.7. So again, this in the second line setting of metastatic bladder cancer, I think is a clinical meaningful survival improvement. On subset analysis, the benefit was in point of fact obtained in all patient groups, patients with lymph node metastasis, patients with visceral metastasis, elderly patients, they all had similar benefit as compared to the chemotherapy. Also, with regarding to the PD-L1 expression, also the patients who were having no PD-L1 expression on the tumor cells and the immune cells, they had the survival benefit as compared to chemotherapy. So, as of to date, the PD-L1 testing doesn't discriminate between patients who are eligible for this type of treatment. Now, regarding the side effects, in point of fact, pembrolizumab was very well tolerated. It has a side effect profile, as we already know in other cancers, with single checkpoint inhibition, and it was better tolerated actually than the chemotherapy. So the toxicity profile was mild. The drug was very well tolerated with just some minor side effects and some incidental immune-related side effects. Some rashes, some diarrhea, and very rare cases of other immune side effects. At the ESCO meeting last year, we also presented the quality of life results. And also quality of life was better on patients receiving pembrolizumab, and it was better sustained as compared to the chemotherapy. So taking everything together, I think that there is a robust survival improvement by pembrolizumab. It's better tolerated, and also quality of life is better sustained. Now, the results of this trial have been previously reported. It has been reported at the ESCO meeting last year, 2017. We had more mature results at the ESMO meeting in Madrid in September 2017. And the research that we present at this meeting is actually a 2-year survival, so real mature data. And again, as I mentioned, the data have sustained. There are no long-term side effects that are any different from the modest side effects that we have reported before. And I think it's a new standard treatment in the second-line setting of patients with advanced or metastatic bladder cancer, again, who have been exposed to platinum-based chemotherapy at an earlier time. That's what I wanted to present to you. Thank you for your attention.